Testing for TB often starts with a purified protein derivative, or PPD intradermal skin test, sometimes known as a tuberculin skin test, MAN2 test, or simply TB test. With this test, tuberculin is injected between layers of the dermis. Tuberculin is a component of the bacteria, and if a person has previously been exposed to TB, the immune system reacts to the tuberculin and produces a small, localized reaction within 48 to 72 hours. If the reaction creates a large enough area of induration, rather than just redness, it's considered to be a positive test. Positive tuberculin tests simply mean that the patient's been exposed at some point to TB. It does not differentiate between active and latent disease. As an alternative to tuberculin skin tests, there are also interferon gamma release assays, or IGRAs, which look for evidence in the blood of previous exposure to TB proteins. Since this one's a blood test, you do not need to show up again to have the test read like you do with a PPD. Also, the IGRA is more specific to TB rather than other types of mycobacterial infections, and is unlikely to be positive as a result of having BCG vaccine in the past, a vaccine that protects against TB. And this is a pretty useful feature of IGRAs, since BCG vaccine is given to many children around the world to prevent disseminated TB. After doing a screen test with PPD or IGRA, anyone with a positive result typically gets a chest X-ray to look for signs of active TB disease. In patients with symptoms like fevers, night sweats, weight loss, and coughing up blood, or hemoptysis, it's important to collect samples from either the sputum or via bronchoalveolar lavage, which is where the bronchoscope is inserted through the mouth or nose into the lungs. Fluid is squirted, and then the fluid is collected. These samples can get sent to the lab for staining, culture, and PCR to look for evidence of Mycobacterium tuberculosis.